So your blood pressure was 121 over 17 millimeter of mercury, and you're like, perfecto, I don't have high blood pressure. I don't have any risk of stroke. But do you know there are some people with the same kind of blood pressure as suffer stroke, even though they were not expecting it? And in this video, I will let you in on some of the reasons why this could happen. Although high blood pressure is the single biggest risk factor for a stroke, but other factors could contribute as well. And here they are. Number one, increasing age. As people increase in age, 40 years and above, the arteries that supply blood to vital organs like the brain, the heart, the kidneys, they lose elasticity. And this causes them to become stiff. So as a result of this, it can become increasingly difficult for them to supply blood to these vital organs. And if this happens in the brain, a stroke may occur. So increasing age is one of the factors that can increase the risk of stroke in people with normal blood pressure, alongside other factors I'll be mentioning. Number two, unhealthy diet. Excessive consumption of diets that are high in trans fats, saturated fats, like your pastries, your deeply fried foods, sausages, and the rest of them, can cause fatty build-up along the walls of the arteries that supply blood to these vital organs. And this fatty plaque, they can block these arteries. When this also happens in the brain, a stroke may also occur. Number three, sedentary lifestyle. Some of you are in the habit of sitting for prolonged periods, 7 to 8 hours, either because of the nature of your job or because you just find pleasure doing it. This is not good for your health, because aside the fact that it can raise the risk of obesity, type 2 diabetes, increase the risk of pulmonary embolism, can also affect vascular function, and all of this can contribute to the risk of stroke in people who have seemingly normal blood pressure. Number four, chronic smoking. When you ask some people to stop smoking, they will argue with you and say, I've been smoking for 10 years and my BP is excellent. My readings are always around 119 over 80, 120 over 78 and thereabouts. But what they don't know is that beyond the numbers, the arteries are silently being damaged by this smoking, because smoking damages tiny blood vessels of your vital organs like the kidneys, the arteries, the brain, and they can increase the risk of clot formation within these arteries. They can also narrow these blood vessels, and both of these can reduce blood flow to vital organs. And since we are talking about the brain, when there's a reduction in blood flow to the brain, you already know what will happen, right? A stroke. So even though you're seeing good numbers are not enough. Damages may be ongoing for years in the arteries that may eventually cause a stroke. Number five, obesity and type 2 diabetes. If you continually consume all these highly sugary foods, highly salted foods, and all kinds of food that makes you obese, it can increase the risk of type 2 diabetes. And type 2 diabetes can damage blood vessels throughout the body, which include blood vessels of the brain. You know what this already means, right? Reduction in blood supply to the brain, and eventually a stroke. Number six, certain medications like some blood thinning medications, some hormonal therapy, among